the cameras flashed, the crowd froze. And just like that, Hollywood had a new obsession.
But sometimes the biggest stories aren't on the red carpet. Sometimes the most terrifying reality is hiding right in plain sight.
Welcome to Starscope Report, where Jordan and Jamie uncover Hollywood drama, music industry shakeups, and viral influencer scandals. From red carpet surprises to social media controversies, we dive deep into the stories behind the fame.
And today's deep dive is, honestly, it's a really heavy one.
Yeah, it really is. If you've been on the internet lately, you've probably seen the headline, RHOC star Jeana Keough reveals devastating cancer diagnosis.
Right, it's been all over TMZ, Nicki Swift, Entertainment Now, just everywhere.
Exactly. And today we are taking a close, honest look at the 70-year-old Real Housewives of Orange County original cast member. She was recently diagnosed with squamous cell carcinoma of the tongue.
Which is just, it sounds terrifying.
It is, and our mission today is to cut through the noise of those tabloids. We've got a diverse stack of sources, pulling from celebrity news outlets, but also the deeply personal GoFundMe page set up by Jeana's family.
Yeah, and to make sure we actually understand the science behind those headlines, we're bringing in clinical oncology resources. We're looking at the Mayo Clinic, insights from head and neck surgeon Dr. Stephen Sperry, data from Dr. Amit Chakraborty, and some really detailed research from the Pakistan Oral and Dental Journal.
We want to unpack her actual medical timeline, decode the mechanics of tongue cancer, and, really look at what happens when the illusion of celebrity wealth collides with the devastating physical and financial realities of a major health crisis.
Absolutely.
And that's not even the wildest part. Later in the deep dive, we'll talk about the shocking twist nobody saw coming with her surgery. But let's start with the timeline, because it is incredibly deceptive.
It really is. It starts a few months ago.
Right. Yeah, exactly. So a few months ago, Jeana was visiting her daughter, Keough Bosworth, down in Florida, and she mentions this painful spot on her tongue.
Okay.
Keough asks how long it's been there, and Jeana realizes she has been dealing with it for nearly a year.
A year?
A whole year. I have to admit, I really struggle to understand how someone can ignore a tumor in their mouth for 12 months. You use your mouth constantly. How does a severe oral cancer masquerade as a mundane dental issue for that long?
Well, that delay is actually, it's one of the most common and most dangerous features of oral cancer.
Really?
Yeah. The Mayo Clinic notes that tongue cancer often begins as just a persistent ulcer, or like a white patch or a red sore that simply doesn't heal.
Just looks like a normal canker sore.
Exactly. But consider the environment of the human mouth. It is incredibly dynamic. Our teeth shift, we chew abrasive foods, we accidentally bite our cheeks all the time.
Oh, I bite my cheek at least once a week.
Right. So we are biologically conditioned to experience minor oral trauma and just expect it to heal on its own.
So she assumes it's just mechanical friction, like a tire rubbing against a wheel well or something.
Precisely. She figured it was just a jagged tooth. She even went to the dentist multiple times to have the tooth filed down. And Dr. Stephen Sperry points out a critical clinical detail here. Early-stage tongue cancers are often entirely painless.
Wait, painless? How is that possible?
Because the nerves in the tongue haven't been deeply invaded yet. The fact that it doesn't hurt gives patients this massive false sense of security. They get the tooth filed down and think, problem solved.
Wow. It's basically like a check engine light coming on in your car, and instead of taking the engine apart to see what's wrong, the mechanic just puts a piece of black tape over the dashboard light.
That is a great analogy.
The underlying failure is still happening, and that delay costs you severely. What was supposed to be a one-time surgery to simply remove the tumor escalated into a total nightmare.
Yeah, because they found out it wasn't just localized anymore.
Right. According to Keough's updates on the family GoFundMe, doctors recommended a second surgery to remove lymph nodes, and that's when they discovered the cancer had spread.
And once it spreads, the treatment protocol shifts from localized surgery to basically systemic warfare.
Jeana is now in her 5th week of this relentless regimen of chemotherapy, radiation, and immunotherapy. Keough writes that her mom is exhausted, she's struggling to stay awake, and becoming severely malnourished.
God, that is so hard to hear.
It's awful. The pain in her throat and tongue makes swallowing even tiny sips of water or bites of food completely agonizing.
And that is the brutal reality of treating head and neck cancers. The treatment area is the exact same anatomical pathway you rely on to sustain life.
Right, you can't just bypass it.
No, you can't. Your mouth and throat are necessary for hydration, for nutrition, for breathing.
It feels a bit like trying to gut and remodel a kitchen while the family is still legally required to cook 3 meals a day in it.
Yes, that is exactly what it's like.
You can't just shut the mouth down and put a cast on it to let it heal. Every time you swallow, you are activating tissue that is being actively bombarded by radiation and chemotherapy.
That is an incredibly apt way to visualize it. The radiation is designed to shred the DNA of the cancer cells, but it invariably damages the healthy mucosal lining of the throat as well, which leads to severe ulcerations.
Ugh, that sounds excruciating. If you are loving these Hollywood twists and deep dives, by the way, make sure you are subscribed. We have got even crazier stories ahead, and we really appreciate you tuning in.
Definitely hit that subscribe button.
So let's zoom out and look at the cellular level here for a second. We hear the term squamous cell carcinoma all the time, but for those of us without medical degrees, what exactly is a squamous cell, and why is the tongue so prone to this specific type of cancer?
Okay, so if you think of your body's tissues like building materials, squamous cells are the flat, scale-like tiles that line the surface of your skin, your throat, and your tongue.
Okay, like protective tiles.
Right. They are protective. They are designed to take a beating, taking the physical friction of us chewing food and speaking. And because they are constantly taking damage, they're constantly shedding and dividing to replace themselves.
And every time a cell divides, there is a chance for a microscopic typo in its genetic code.
Yes, exactly. Most of the time, your immune system catches that typo and destroys the cell. But sometimes, a mutated cell slips past the defenses and begins dividing uncontrollably. That is carcinoma.
Wow.
And the tongue itself is divided into two parts. You have the oral tongue, which is the front two-thirds you can stick out, and the base of the tongue, which anchors into the throat. Jeana's tumor is on the oral tongue.
Right, the part she could actually feel rubbing against her tooth.
Yep. And statistically, according to our medical sources, these tumors most commonly appear on the lateral borders, so the sides of the tongue.
I was reading the study from the Pakistan Oral and Dental Journal, and their data backs that up perfectly. They analyzed a large cohort of patients and found that over 52% of these cancers present on the posterior lateral border, meaning the back sides of the tongue.
Which is exactly where your molars might rub against it.
Right. If you're listening to this and running your tongue along your teeth right now, because I know I am, don't panic. But it does bring up a vital point about how we ignore our own anatomy. I also want to push back on a common public assumption here.
What's that?
I think when the average person hears mouth cancer, they immediately picture someone who smokes 2 packs of cigarettes a day or drinks heavily.
Oh, for sure. Tobacco and alcohol use are absolutely the primary historical risk factors.
Yeah.
They just bathe those vulnerable squamous cells and carcinogens.
But that's not always the case anymore, is it?
No, not at all. Dr. Sperry's clinical notes emphasize a changing demographic. Tongue cancer occurs frequently in patients who have never smoked or drank excessively. It is increasingly common to see this in totally healthy individuals without any traditional identifiable cause.
And the Mayo Clinic highlights that HPV, the human papillomavirus, is heavily linked to head and neck cancers now, though typically more at the base of the tongue rather than the oral tongue where Jeana's is located.
Right.
Regardless, you simply cannot write this off as a smoker's disease. Now, we mentioned earlier that Jeana's cancer had spread to her lymph nodes. I want to talk about how doctors stage this, specifically this concept of depth of invasion.
Oh, this is a crucial concept.
To me, a tongue tumor sounds a lot like an iceberg. Like what you see on the surface, the little white patch or the ulcer, is just the tip. The most dangerous part is what you can't see, diving deep down into the muscle.
The iceberg analogy perfectly captures the danger here. In oncology, they use the TNM staging system, which evaluates tumor size, node involvement, and metastasis. For the tumor component, depth of invasion is the critical metric. Dr. Sperry explains that a thin tumor, say 2 millimeters deep, behaves entirely differently than a tumor invading 10 millimeters deep.
Even if they look exactly the same size on the surface.
Exactly. Even if they appear identical in size on the surface of the tongue.
Why does the depth change the behavior so drastically?
Because of the anatomy of the tongue itself. The tongue is an incredibly dense, highly vascular muscle. It is packed with blood vessels and lymphatic channels.
Okay, I see where this is going.
And it is constantly moving.
Right.
Every time you speak or swallow, the tongue contracts. If a tumor has invaded deep into that muscle tissue, those constant muscular contractions act almost like a pump, squeezing the cancer cells directly into the lymphatic highway that drains into the cervical lymph nodes in your neck.
Wow, that is terrifying. That completely explains why the staging data from the Pakistan Oral and Dental Journal is so grim. They found that nearly 74% of patients present in advanced stages, so stage 3 or stage 4.
It's because of that delay.
Right. By the time the tumor is painful enough for the patient to stop ignoring it, it has already drilled down into that vascular highway and pumped cancer cells into the neck.
And once it hits those cervical lymph nodes, forcing the kind of second surgery Jeana had to undergo, the survival rates can plummet by up to 50%. The disease has transformed from a localized surgical problem to a systemic, life-threatening crisis.
Which brings us to the surgical reality. And honestly, this is the shocking twist I teased earlier. We're talking about a glossectomy. I was looking at Dr. Sperry's notes on how they reconstruct the tongue after removing a large portion of it, and I'm honestly struggling to wrap my head around the mechanics.
It is wild.
He details a procedure called a radial forearm free flap. They literally take a piece of skin and tissue from your forearm, along with its blood vessels, and transplant it into your mouth to rebuild the tongue.
Yeah, it's a massive, body-altering undertaking.
But wait, if you use arm skin to rebuild a tongue, it obviously doesn't have the same specialized nerves. How does a patient even relearn to swallow if they can't feel the food in the back of their mouth?
That's the hardest part. When a surgeon performs a glossectomy, which can be a partial or total removal of the tongue, the patient loses the mechanical ability to push food backward into the throat safely.
Without choking on it.
Right, without aspirating it into the lungs. The radial forearm flap is designed to restore the physical bulk of the tongue. Under a microscope, surgeons painstakingly connect the tiny blood vessels from the arm tissue to the blood vessels in the neck so the transplanted tissue survives.
But the sensory function is just gone.
Largely, yes. I mean, the new tissue might regain some basic sensation over time, but it will never have the intricate taste buds or the hypersensitive motor control of a natural tongue.
That is just mind-blowing.
Patients have to undergo intense, exhaustive speech and swallowing therapy just to learn how to manipulate this new, numb mass in their mouth to speak and eat safely.
Undergoing a microsurgery like that, followed by weeks of radiation and chemotherapy, I mean, that would devastate a 25-year-old.
Well, absolutely.
But we have to factor in Jeana's specific demographic reality. She is 70 years old. I reviewed the clinical data from Dr. Emmett Chakraborty, an oncology specialist, and it is staggering how much age alters the battlefield of cancer treatment.
The demographic factor changes the entire prognosis. Dr. Chakraborty's data clearly outlines survival rates by age bracket.
What are the numbers?
So for tongue cancer patients under the age of 45, the 5-year survival rate is very high, resting between 85 and 90%.
Yeah, that's pretty good.
Because younger patients possess robust immune systems, incredibly rapid cellular regeneration, and they have the physical stamina to tolerate maximum doses of aggressive chemotherapy and radiation.
But Jeana is in the 65-plus bracket, and for that age group, Dr. Chakraborty notes the survival rate drops dramatically, down to between 50 and 65%.
It's a huge drop.
Why such a steep cliff? Is the cancer biologically more aggressive in a 70-year-old?
It's not necessarily that the cancer cells are more aggressive. It's more that the host's ability to withstand the cure is severely diminished. Older patients frequently face what geriatric oncologists call frailty syndrome.
Frailty syndrome, okay.
Their physiological reserves are just depleted. When chemotherapy enters the bloodstream, its job is to attack fast-dividing cells. This kills the cancer, but it also kills healthy fast-dividing cells in the bone marrow, the hair follicles, and the digestive tract.
And a younger body can replace those healthy cells quickly.
Correct. But an older body has slower DNA repair mechanisms. The cells simply do not bounce back from the toxic damage. Furthermore, older patients almost always present with existing comorbidities.
Like other health issues.
Yeah, perhaps mild hypertension, slight heart issues, or prediabetes. These underlying conditions severely complicate which oncology medications can be administered safely without triggering organ failure.
Wow. This connects so directly to what Cara posted on the family GoFundMe regarding her mother's malnourishment. At 70 years old, Jeana isn't just fighting rogue squamous cells. She is fighting the sheer, brutal physical exhaustion of the treatment itself.
It's a double battle.
Cara mentioned the severe malnourishment because it simply hurts too much to swallow. I would imagine that when you are 70, you do not have the metabolic reserves to just stop eating for a month.
No, you really don't.
That inability to swallow food isn't just an unfortunate side effect. It is an active, critical threat to her ability to survive the chemotherapy.
You've hit on a vital clinical challenge. The swelling of the tongue and throat post-surgery and during radiation is immense. Patients often require a temporary nasogastric feeding tube or a PEG tube directly into the stomach just to maintain their caloric intake.
Just to keep them alive through the treatment.
Exactly. If a patient is relying on oral intake during radiation, which, as we discussed, is actively burning the mucosal tissue of the throat, every single sip of water is an absolute battle. The treatment intentionally pushes a 70-year-old body to the absolute brink of its endurance.
So you have this incredibly grueling physical reality happening in the hospital. But then you have the financial reality waiting at home.
Let's shift to the human element here, where the glamour of reality television crashes into a deeply tragic reality.
Right, because the bills don't stop just because you're sick.
No, they don't. Jeana works as a real estate agent. By definition, that is a commission-based profession.
Which means if you are not actively showing properties and closing houses, you are generating zero income. There is no corporate safety net, there is no paid medical leave.
And she physically cannot work. This has created an enormous, immediate financial burden. Her daughter, Cara, lives all the way across the country in Florida raising young kids. That geographical distance makes hands-on caregiving a logistical nightmare.
Can't even imagine the stress. Cara launched this GoFundMe just to help with her mother's basic living expenses, specialized nutrition, and out-of-pocket support costs. As of our sources, it's raised over $41,000 of its $50,000 goal, backed by about 330 individual donations.
It really reveals a profound vulnerability that the general public rarely associates with television personalities. We assume fame equates to infinite resources.
We do. But we also have to place this cancer diagnosis in the context of the Keough family's recent history, because this family has been battered by an unimaginable amount of tragedy over a very short period.
Yeah, it's been one thing after another.
According to Nikki Swift, back in April 2020, Cara experienced the devastating loss of her infant son during childbirth.
Oh, that is so heartbreaking.
Then just 1 month later, in May 2020, Jeana's ex-husband, former pro baseball player Matt Key, died suddenly of a pulmonary embolism.
The concept of compounded grief is critical here. Losing a grandchild and a former spouse within weeks of each other creates an immense psychological toll.
It really does.
And chronic grief actively suppresses the immune system. Facing a stage 3 or stage 4 cancer diagnosis just a few years after that level of trauma requires a level of psychological resilience that is astounding to consider.
It really is. But this is also where we see a fascinating shift in the reality TV dynamic. When we think of the Real Housewives franchise, we are conditioned to think of manufactured drama, thrown wine glasses, and petty scripted arguments. That is the product they sell.
Right, that's what we tune in for.
But Entertainment Now reported on how the original Orange County cast has responded to Jeana's diagnosis. Vicki Gunvalson and Tamra Judge, who are massive foundational names in the Bravo universe, have publicly rallied around Jeana.
I saw that. It was really touching.
They are sharing the GoFundMe on their massive social media platforms, urging their followers to donate and making significant personal donations themselves.
This really highlights the genuine human bonds that form beneath the surface of that unique environment. These women were the pioneers of a massive cultural television format back in 2006.
Yeah, they started it all.
When a life or death crisis hits, the performative reality TV personas drop immediately. You are left with a group of women who have shared a very strange, highly scrutinized slice of life together for 2 decades.
It's a reminder that true friendship often outlasts the reality TV cameras. The cameras stopped rolling on Jeana as a full-time cast member years ago, but when the chips are down, Vicki and Tamra are leveraging their considerable fame to keep their former colleague financially and emotionally afloat.
It is a powerful testament to authentic community support, entirely divorced from a manufactured storyline or a dramatic reunion couch.
So what does this deep dive mean for you, the listener? Let's distill the absolute critical takeaways from Jeana's ongoing medical journey. First and foremost, do not ignore persistent sores in your mouth.
Seriously, don't wait.
If you have a spot, an ulcer, a red or white patch on your tongue or cheek that doesn't heal after 2 or 3 weeks, do not assume it's just a rough tooth rubbing against it. Do not put a piece of tape over the check engine light. Get to a specialist and demand a biopsy.
Yes. Your first line of defense is a regular dental exam. Dentists are trained to look for these exact abnormalities. And if you or a loved one are over the age of 65, vigilance is even more crucial.
Because the treatment is just so much harder.
As the clinical data showed us, the biological realities of aging make the treatment for advanced squamous cell carcinoma exceptionally grueling. Early detection isn't just about saving your life, It's about preserving the basic quality of your life.
Yeah.
Your ability to speak clearly, to taste food, to swallow water without requiring a surgically reconstructed forearm flap in your mouth.
It's about catching the iceberg while it's still small, before it sinks the ship. Jeana's story is a stark, heartbreaking reminder of that urgency. And stay tuned and hit that subscribe button so you don't miss what's coming next on our future deep dives.
We appreciate all the support.
I want to leave you with a final thought to mull over. Building on what we've discussed today about the collision of fame and finances, think about the pervasive illusion of celebrity wealth. We watch these shows, we see the gates of Coro de Casa, the designer clothes, the luxury cars, and the sprawling mansions.
It all looks so perfect.
It does. But if a famous television pioneer, a woman who has worked as a successful real estate agent for decades, finds herself so financially vulnerable from a single health crisis that her family must resort to crowdfunding for her basic living expenses and nutrition, what does that reveal about the hidden catastrophic financial burden of serious illness for the average person?
That is a really sobering question.
If a celebrity is one devastating diagnosis away from a GoFundMe page, where does that leave the rest of us? It's something to consider the next time you watch a reality show.
Definitely.
You've been listening to Star Scope Report, where Jordan and Jamie uncover the stories shaping Hollywood, music, and pop culture. Thanks for tuning in, and don't forget to subscribe for more stories that keep the stars shining.